Hello, it's Dr. Albert right here, and basically in this video, we're going to be talking about the safe days method. So, I actually made a lot of videos on the safe days and the unsafe days of the menstrual cycle and how to calculate them. In my previous videos on the channel, you can actually check them out and you actually get to learn more about how to get your safe days and the unsafe days and fertile days and stuff like that. But in this video, you're actually going to be talking about the safe days method. So, first of all, I want you to understand that for the safe days to actually work for you, you actually need to make sure that you are actually having a very good cycle. What do I mean by a very good cycle? Your cycle doesn't actually fluctuate. So, one usually, I tend to use the assumption that most cycles of women tend to take 28 days. Okay, now 28 days. One, and a reminder is that a safe day or safe days, these are the days in which when one actually has unprotected intercourse, okay, they have low chances of getting pregnant. So those are the safe days. Now we have also what they call unsafe days, okay? Now, so using the assumption of the 28-day cycle, you actually look at this in this way. So one, a little bit more the science of this is that one is that a menstrual cycle is actually constituting of two things. We have the follicular phase, and then we have the luteal phase. So understanding that the luteal phase, which is usually the last 14 days of the cycle. So if a woman actually has a cycle of 28 days, if you want to learn how to get the length of your cycle very well, please check out my video on this channel so that you can actually learn how to do that very well. So the luteal phase, which is usually constant, the luteal phase is constant usually 14 days. So one, knowing the luteal phase helps us to actually identify the ovulation day. How does this happen? So a cycle of 28 days, when you actually subtract the luteal phase, which is usually 14 days, so you get 28 days minus 14 days, okay? So that actually means that the ovulation day is actually going to be around the 14th day of the cycle, okay? Now, another thing that you need to keep in mind is that one, there are two things. One, we have the egg, which is usually known as the ovum. Then we have another thing known as the sperm. That's the thing which actually fertilizes the ovum or the egg, just if that's the way you want to call it. So, the viability of a sperm when actually one has like unprotected sexual intercourse probably takes 3 to 5 days. Okay, that's the viability inside the female genital tract into that stuff, the reproductive system of the woman. And then we have the ovum, that's the egg, lasts approximately 24 to 48 hours after ovulation. Okay, now this actually means that around the 14th day, that is one of the most fertile days in the menstrual cycle. So if actually someone gets to have unprotected sexual intercourse around the 14th day, they actually higher chances of conceiving, because remembering that I've actually been telling you that the sperm lasts from 3 to 5 days inside the female genital tract, and then you actually have the ovum, which lasts, the viability is 24 to 48 hours. So if you actually have sex around, unprotected sex around that period, you have high chances of conceiving. So in one way or the other, the safe days method can actually be very important if a couple want to actually conceive a baby. Okay. Now, as considering a cycle of 28 days and ovulation date around the 14th day, you can actually do more tests to verify that, actually be sure that you're actually ovulating through testing the LH, the luteinizing hormone levels, which usually the hormone actually surges during ovulation as the egg is actually being released from the ovary. The whole stretch of the menstrual cycle, there's always a fluctuation of different hormones, including estrogen, progesterone, luteinizing hormone. Okay, now I want you to understand that around the ovulation date, that is when we have actually what they call the LH surge. Okay, so the LH surge, you doing testing for the LH levels within the blood can actually be a very important factor, an important hormone that you can actually use to detect if someone is actually ovulating or not. Okay, if you're considering the 14th day to be the ovulation day, add your 3 to 5 days above the 14th day and subtract the 3 to 5 days before the ovulation day, that can be a very good insight in predicting your fertile days. So that means closer to the 14th day of the cycle, a woman is actually more fertile to can actually easily get pregnant because of all that stuff happening that I've actually explained. Now, that gives you an insight on what they call the fertile days. In stroke, what I mean by those are the fertile days, those are the unsafe days. Hope you're together on that. Now, the rest of the days outside that range, the 3 to 5 days around the ovulation date, minus that is before and after. Above that, you're actually going to be in the safe days of your cycle. Now, I don't want you to actually get to be taken up by all this, because actually for you to be able to use this method, you need to be able to actually track your cycle very well, because it actually needs a lot of discipline for actually notice that, okay, if you're actually bleeding today, this is my first day of my cycle, and this is when my cycle ends. You need to be very sure, you need to be very good at tracking your cycle so that you can actually use this information so that you don't make any mistakes. Okay. And the problem with this method of the safe days method is that if you're actually using this safe days method, it doesn't protect you from the sexually transmitted infections, the STIs of gonorrhea, the syphilis, the HIV, and all that. So keep that in mind. Okay. Now, I want us to know that if you're actually having an irregular cycle, this method is actually not very good for you, because you actually find that probably this month your cycle is 28 days, and then the next time it's 33 days. Like, it keeps on fluctuating, and that is not very good. It actually makes it very hard for you to easily approximate your ovulation day. And when you don't actually get the ovulation day correct, you're actually going to mess it up a little bit, because you're actually going to have a real demarcation and easily something that could actually help you estimate your fertile days, as it is very important also get the safe days of the menstrual cycle. Now, just for practicability, I actually have a friend who has actually been very, yeah, who has actually been trying to use this safe days method, and they actually didn't get it right one time, and they are now pregnant. So I don't want you to mess it all up. Try to make sure that if you feel you actually can't use this method, you can actually try using the other alternative methods through using the barrier methods such as the condoms. Yeah, condoms gives you protection from the STIs, as well as protection from pregnancy. Okay, so let's keep that in mind. And another thing I want you to know is that, I mean, if you like these videos, please consider subscribing to our YouTube channel. See you next time.